We are from Casa Colina Hospital and Centers for Healthcare, and we are here today to talk to you about stroke with a focus on prevention and rehabilitation. My name is Dr. Elliot Block. I'm a DO resident here at Casa Colina.
And my name is Dr. Neha Dhadwal. I am also one of the residents here.
And we also have an amazing team of therapists who's going to be joining us a little bit later in the talk to go over some more topics in stroke. So let's go over some objectives for today. We're going to learn about different types of strokes and a couple of facts, which we hope not to bore you too much with too many facts, but I'm sure that they'll be very good ones for you. And we're also going to identify some stroke risk factors as well as tips for prevention. We're going to go over the signs of stroke so that you're all aware of what to look out for that may be related to a stroke. And then we're going to learn about treatment options and also how we rehabilitate folks after they've had. The importance of this is kind of highlighted by this fact right here. Every 40 seconds, someone in the US has a stroke. So it's a very common.
Let's start by defining a stroke. So what is a stroke? A stroke is anything that compromises the blood flow to the brain, and it essentially deprives brain cells of oxygen, which they need to function. So there are two types of strokes. And the first type is a block to the brain, and this is caused by a blood clot. The second type is a hemorrhagic stroke or a bleed, which is what happens when a blood vessel in the brain bursts. The most common type of stroke is an ischemic stroke.
I'd like to go over really quickly what a TIA or a mini stroke, as it's sometimes called. So TIA stands for transient ischemic attack. As we just learned with Dr. Dhadwal, ischemia or a blocked blood vessel is what causes a stroke. So a TIA, as it says in the name, is a temporary blockage. So by definition, the symptoms associated with the TIA would resolve within 24 hours. The symptoms are very much like the symptoms that one would experience with a stroke, which we'll go over in a little bit. It is important to note that it does not cause permanent brain damage if it is a true TIA, but it does indicate that somebody is at high risk for having a full stroke. So the American Stroke Association indicates that TIAs are heralding signs or symptoms in 12% of all strokes. So there is a higher risk within 90 days after a TIA. So all of this to highlight the importance of seeking medical care and not ignoring any kinds of symptoms that could be a TIA, even if they do resolve within a day.
So why is it important? We already emphasized that statistic in the beginning, but basically stroke is a leading cause of serious disability in the United States, and depending on where the stroke was, it can affect a variety of things in your life, whether it be your ability to walk or your ability to speak. And there are approximately 7 million stroke survivors currently in the US. And it is also one of the leading causes of death. But the key thing here is that 80% of strokes are actually preventable. So these are some of the things that we're going to highlight throughout the course of this presentation.
All right, so a couple of things that we'd like to just highlight here before we get into it is being stroke smart. So we want to prevent by learning about the risk factors and how we can treat some of those in order to lower the risk of stroke. How to treat strokes, which is critically important to recognize what symptoms are associated with stroke so that we can act. Then also, after a stroke has occurred, how we reach out for resources to recover and get the appropriate rehabilitation after a stroke. So the time that we spend together is really precious. So we're going to spend a little bit of time with you to learn how to prevent and end stroke.
So a stroke can affect people at any age, but the risk does go up as a person gets older. There are certain ethnicities that are also at higher risk for stroke. For example, Blacks have as much as a 2-time higher risk compared to whites, and the death rate in Hispanics can also has also been going up since about 2013. So it's important to know your risk factors so you can make those changes to help prevent a stroke. Like we said, 80% of strokes are actually preventable.
So let's run through a couple of the risk factors that are some of the causes of stroke. Again, at least 1 in 3 US adults will have one of these conditions. They're very, very common. To be treated, and treating them does lower the risk of subsequently having. So the number one modifiable risk factor, modifiable meaning treatable and preventable with relation to stroke, is high blood pressure. So that's hypertension. And another one would be high cholesterol, or hyperlipidemia is another term that you might hear. Smoking is a very important risk factor for stroke, as well as obesity and diabetes. There are some other additional risk factors that we want to identify and treat, which is atrial fibrillation, meaning abnormal rhythm in the heart, as well as coronary artery disease, which means partial narrowing of the arteries that supply the heart with blood.
So the reason this is important is because you have the power to reduce your risk of stroke. And one of the important things that you can do is start the discussion with your physician about how to improve your health and make the changes that you need to decrease your risk. So if you have, risk factors that put you at risk, you need to take control and try to, work on these things. So for example, if you smoke, try to stop. It's difficult, but you can also have a discussion with your healthcare provider about ways to help you stop smoking. If you have diabetes or pre-diabetes, you should try to watch your sugar closely. If you, are offered, different options when you eat, try to choose the healthier option, try to incorporate exercise into your day-to-day life, take your prescribed medications as instructed by your physician, and follow up with your physician regularly.
As rehabilitation doctors, we absolutely love talking with all of our patients about all of these conditions and finding creative and positive ways that we can help promote health. So not just treating disease, but also seeking the health in our patients. And we know that there are many, many other providers in the community, primary care physicians, family physicians, who are also very focused on recognizing these conditions and addressing them to reduce your risk of stroke. So let's talk a little bit about what stroke looks like. So again, the importance of knowing what it looks like is so that we can recognize it and then get you the treatment that you need as soon as possible. And treatment, when applied quickly, can significantly increase your chance of survival and minimize disability.
So strokes can present in a variety of different ways. One of the examples that people commonly see is sudden numbness or weakness on one side of the body, and it can affect the face, the arm, the leg. A person can just start to act differently, like they may act confused or have trouble speaking or have trouble understanding things that are being said to them. They may report difficulty seeing or trouble with walking, dizziness, loss of balance, and oftentimes they report a severe headache, one of the worst headaches of their life. And the reason why it's so important to recognize these signs is time is brain. So you need to act quickly and get the help that you need.
So there's a fun little mnemonic that we use, and it's called ACT FAST. The F stands for facial drooping, as we see in the first picture. So that would be one side of the face having a droop or being lower than the other side of the face. The A stands for arm weakness. So that would be one arm being weaker than the other. And then the S stands for speech difficulty. So that's what Dr. Dhadwal was mentioning with slurred speech, not speaking as they normally do, having difficulty finding words when, the previous day they didn't have that. And then the T stands for time. So time to call 911. If you recognize any of those symptoms from the F.A.S., so face, arm, and speech, then it is of the utmost importance that you call 911 and get the treatment that you need as fast as possible.
Hello, I'm Melissa Howard, Director of Speech Pathology. We're going to talk about what does stroke recovery look like. There's still so much we don't understand about the brain and how it seemingly can repair itself after a stroke. Some brain cells may be only temporarily damaged and may resume functioning. In some cases, the brain can relearn what was lost, having other parts of the brain take over for the damaged part. People who have had a stroke sometimes experience remarkable and unanticipated recoveries that can't be explained. General recovery guidelines show that 10% of stroke survivors recover almost completely. 25% recover with minor disabilities. 40% experience moderate to severe disabilities requiring special care. 10% require care either at a skilled care facility or long-term care facility. And there is a 15% mortality rate. Stroke survivors and families can find workable solutions to most difficult situations. It does require a lot of patience, creativity, and tenacity. Stroke survivors may have challenges in physical abilities, daily living, communication and relationships, and emotions and behavior. Changes after a stroke are highly dependent on the part of the brain that was affected. An individual might have problems in any of these areas: moving parts of the body, memory, thinking, vision, pain, bladder control, feeling very fatigued, sleeping a lot, and depression. Let's talk about the parts of the brain and the impairments that you might see that correlates with them. The frontal lobe, as shown in the red section, is responsible for personality, emotions and arousal, intelligence, ability to concentrate, make decisions, plan, put things in order, and being aware of what's around you. It also is responsible for voluntary movement, ability to speak and write, and behavior control. The parietal lobe, the yellow part on the map, is responsible for sensory input, being aware of pain, touch and temperature, interpreting colors, sizes, and shapes in our environment, understanding space and distance, and being able to compute math calculations. The occipital lobe, the blue section, is responsible for vision and interpreting the things that you see. The cerebellum, the brown part, is responsible for balance, motor coordination, posture, and fine motor skills. The purple area, as shown on the map, is the temporal lobe, and that assists you to be able to understand language, hear, recall things, store memories, organize and plan, and regulate your behavior and emotions. The brainstem is quite critical. It is responsible for our breathing, our heart rate control, consciousness, alertness and wakefulness, our swallowing, blood pressure, and body temperature. The left side of your brain controls the right side of your body. You use the left side of your brain to move the right side of your body. This also helps you to figure out math and science problems and to understand what you read and hear. You may have trouble doing these things if you have a stroke that damages that side of the brain. The right side of the brain controls the left side of the body. The right side is your creativity. That helps you to be able to paint a picture, appreciate art and music, to recognize the emotion in someone's voice, or to plan somewhere to go. Casa Colina offers a continuum of care involving an interdisciplinary treatment guided by physicians to optimize recovery. The team provides rehabilitation services to individuals post-stroke based on their unique needs to overcome the challenges they face in their daily lives. The principles of recovery and rehabilitation here at Casa Colina are an individualized and goal-based program with implementation of research-based practices with a focus on neuroplasticity. It is a multidisciplinary team approach that is physician-led. Now you're going to hear from Marie about the continuum of care.
Hello everyone, my name is Maria Setta and I'm a physical therapist here at Casa Colina. And today I'll be talking with you about what services are available here at Casa Colina Hospital and Centers for Healthcare in relation to stroke recovery and rehabilitation. We've covered so far the basics of what a stroke is, what some of the risk factors for stroke are, and what can be done following a stroke. So I'll be discussing the services that we have available on our campuses. So we have a wide variety of services available here at Casa Colina, ranging from our acute care medical surgical wing to an inpatient rehab hospital facility, our transitional living center, outpatient services, a variety of physician specialty clinics. We have community research opportunities and integrative research with other institutions in the Southern California area, an outdoor adventures program, community outreach programs, and our own research institute on campus. 3 of the primary rehabilitation programs that we have offered here at Casa Colina include the Inpatient Rehabilitation Hospital, which is a comprehensive hospital-based program involving an interdisciplinary team of care providers that includes therapy disciplines of physical, occupational, and speech therapies, our physician team, rehabilitation nursing, and ancillary services as needed per client, including psychology, neuropsychology, recreation therapy. Our Transitional Living Center is also a comprehensive interdisciplinary team approach, but it's a short-term residential and day treatment program, so outside of the hospital setting. Outpatient services are designed for those patients who are able to return home and will benefit from continued rehab services to address their needs following a stroke. These services are wide-ranging and include some of our physician specialty clinics, variety of therapies, neurooptometry, audiology, and neuropsychology. We also have cash-based specialty groups available. Some of these include groups related to brain injury and aphasia. We also have high-level wellness programs for fitness. So there's a variety of things out across our campus to meet everyone's needs. Some of the technologies and specialty programs that we have to address individuals' needs post-stroke include different technologies to address communication, vision training, driving and adaptive drivers retraining, a technology known as electrical stimulation, body weight support systems, robotic devices, aquatic therapy, a specialty wheelchair and seating clinic, assistive technologies, and our fitness programs. So in regards to communication, we heard earlier that following a stroke, there can be a variety of different things that occur within the brain that impact a person's ability to communicate with others. So we have both low and high-tech devices to be able to meet an individual's needs to communicate on a daily basis. This might be something like a picture or word board to be able to break down things into easy to communicate ideas. Might be something that involves eye gaze, where there's a device where eye control following across the screen allows the user to select the words that they're trying to communicate. These are all customizable, and training is available for both the patient and their family in order to make that bridge between utilizing these resources in therapy into their daily lives. We also have a variety of assistive technology options. This includes a variety of equipment or software that enable people to make their daily lives safer, easier, more efficient, or more productive. We have a specialty evaluation program available for those that need it. In terms of vision and returning to driving, we have a variety of options on campus as well. So there's 2 areas that can be impacted for an individual after a stroke. So for vision training, we have both a low vision clinic, but also vision training to address impairments that we might see after a stroke. This might include a device such as the BioNest Integrative Training System, which helps us use different programs on a large screen to work on gaze improvements. We have an adaptive driving program and also a driver's retraining program. We have a driving simulator, which is available in our outpatient therapy department, and also an option for on-the-road van and car training. We have a wide range of options to address individuals' mobility impairments, whether that be weakness, stiffness in the muscles, impaired range of motion. And one of the options that we have for this is called electrical stimulation. We have various modalities to use this technology. VitalStim is one option for individuals having difficulty with swallowing, where the electrical stimulation is applied to stimulate those muscles to strengthen them to improve swallow function. We also have the RTI bikes for both the upper and lower body, which integrates electrical stimulation to help the muscles contract in a synchronized pattern with cycling motion for either an upper body or lower body bicycle. And we have the BioNest systems for both the upper and lower body. For the upper body, it involves grasp and release tasks, which incorporate the electric stimulation into those movements. And for the lower body, it incorporates either lifting the foot up off the floor or helping to mobilize at the knee, that we can carry that over directly into walking. We also have the option of our Excite system, which integrates electrical stimulation into a variety of different functional movements so that we can use that electrical stimulation in real time with the tasks that we're trying to improve. We also have a body weight support system here at Casa Colina in 2 of our locations on campus. And this system is used to provide support, offloading from the floor while performing walking retraining, balance retraining, both over ground or over the treadmill. We also have equipment known as an exoskeleton device. It's a wearable robotic device that can be utilized by individuals with neurologic impairments to either stand and or to walk. It uses robotically controlled joint supports and sensors, as well as movement controls, so that the individual, through a series of retrained movements, is able to take steps with the exoskeleton device.
Hi everyone, my name is Nikisha Gutierrez. I am an occupational therapist at Casa Colina. Today I will be talking about different programs and opportunities that individuals can pursue outside of the typical therapy. The first program we offer at Casa Colina is Outdoor Adventures. It is an adaptive recreation program that empowers people with disabilities through challenging and exciting outdoor activities. They really focus on ability and not disability, and there's really no limitation to the type of activities that they provide to participants. It enables participants to experience success both physically and emotionally, and can be very beneficial to individuals feeling like the world is full of barriers with their disability. Outdoor Adventures, this program utilizes the natural world to create unique opportunities where people with disabilities can participate in day trips and adventures, enjoy a sense of community with others, gain self-confidence by experiencing success through acquiring new skills, share new outdoor experiences, and adventurous activities with people of all abilities. Outdoors Adventures was created in 1985 and has provided people with disabilities access to a wide scope and diversity of activities. Excursions include ski trips, land meet sea sports camps, sailing, and whale watching. Another opportunity that individuals can pursue at Casa Colina is our Research Institute. As an innovator in rehabilitative care, we offer numerous research programs and collaborate with many renowned research institutions in Southern California. The Casa Colina Research Institute conducts basic, translational, and clinical research striving to rapidly transform scientific advancements into improved patient care and outcomes. We are currently recruiting 2 different studies for patients post-stroke. One is including neurorehabilitation with the upper extremity, and the others for individuals with a stroke with aphasia. You can find all our research programs on Casa Colina's website, and can feel free to call our research department with any specific questions. Some questions that we get frequently asked from individuals post-stroke we have here. So the first one is, my stroke was 3 years ago. Can I still make a recovery? The answer is definitely yes. While the window for the most progress post-stroke is about 6 months to 1 year, there is no limitation. Every stroke, every individual, and every recovery will be different. There are research articles from people decades ago that are still making gains in recovery through neuroplasticity with the brain. So there is never a limitation on when you can make a recovery post-stroke. The other question we frequently get is, I'm young and unexpectedly experienced a stroke. Can I still go back to work? This is where your rehabilitative team can really help you with getting back to work, to school, to driving. With our physical therapists, occupational therapists, and speech pathologists, we can help set up a plan that will help you work either collaboratively with other resources such as the Department of Rehab, help you do a driving evaluation, help you get job accommodations or other resources in the community, we can help you obtain that goal. For more information and resources, these are some links you can follow. First is the Casa Colina Hospital and Centers for Healthcare. Our website has many resources and gives you all the programs and services that we offer at Casa Colina. The second one is the American Stroke Association. Third is California Department of Rehabilitation. And last is the World Stroke Organization. If you have any questions for any of us here that presented today, you can contact us by email at care@casacolina.org.